Most people think of dental plaque as just something that makes your teeth look dirty. The truth is, it's far more dangerous than that. The same bacteria hiding in your mouth trigger inflammation that damages your arteries and raises your risk for heart attack and stroke. Today, we're joined by a friend of mine, Dr. Doug Thompson from the Wellness Dentistry Network. He's here to walk us through how you can actually clean your teeth at home the right way, step by step, to remove plaque before it ever becomes a threat. And as Doug will tell us, it's not even technically called plaque anymore, it's something else, biofilm. And he'll tell us why. We'll also show you why testing for harmful bacteria, that mouth biome, the oral biome, is critical. People talk about the gut biome all the time, but not so much about the mouth biome, despite its importance, because the bacteria in your mouth are the very same ones that cause heart attacks. Every day, most dentists in the world get up, take a shower, eat breakfast, and go to work, where most of their patients have bleeding gums. They're so used to it, they don't mention it anymore. And that's tragic because those bleeding gums are a very strong sign that their patient is at risk for a heart attack. So, Doug, it's great to see you again. We saw you this time last year, and we talked about oral health. I miss the days when you and I were hanging around a lot more, but
Yeah.
the Wellness Dentistry Network's growing like mad, and you're trying to develop stuff that works for the beginner dentist as well as the intermediate and the pro. And tell the audience, what does all that mean?
Yeah. Hi, Ford. It's great to be back with you again. The Wellness Dentistry Network is really a resource hub for dentists to have the tools that they need to educate themselves and their patients and the about wellness opportunities in dentistry, meaning that, everybody expects that when you come to a dentist, we can repair your tooth and we can put a new crown in or build up an implant or, we do all that stuff. But if the dentists and the hygienists too that work in the office and the assistants, if they have a keen awareness about how oral conditions affect systemic health, and they can see things that you need to know or that you could know, or if you knew, you might see a physician or you might do something differently. And so that's what the wellness dentistry is. And you and I were chatting a little bit about how far we've come. And I've learned a lot from you, Ford, over the years about medicine and how you're looking more carefully at even things like cardiovascular disease and cognitive decline. And you're helping the people that you serve recognize disease earlier. And we're trying to do the same thing in dentistry. So the Wellness Dentistry Network has a great place, but it's for practices that want to get out of that mainstream drill and fill kind of attitude and start helping patients with more than just their smiles. We want those people smiling to be as healthy as they can be. That's the idea. So it presents some challenges, but it's a lot of fun. I love it.
So let me step back for just a second and maybe restate one of my favorite concepts from when you and I were working together. On my side, your typical doctor gets up, takes a shower, eats breakfast, and goes in and sees 30 to 50 patients and writes a script for statin on over half of them, and then steps into the next room because insurance pays for writing a prescription. He or she really doesn't take the time to understand why that person's LDL went up. And does that person have metabolic disease? It just goes right over his or her head. Meanwhile, the typical dentist is getting up, having breakfast, taking a shower, going into work and seeing, I don't know, 20 to 50 patients. And depending on the practice, 19 to 48 of them have bleeding gums. And he or she's drilling and filling and not asking, why are these gums bleeding? And that's what you do. You teach dentists, you do the same thing that I'm doing with docs, you're doing with dentists, except you're teaching more of the dentists themselves to improve what they're doing. I'm going straight to the patients. So we're going to talk today. You're going to give us an update on your world and how we as patients, as individuals, should be thinking about our mouth. And I'll start off with a very simple and dumb question. I hear plaque sometimes, I hear tartar sometimes. They're not the same thing. Maybe you can start us off with that and then take us a little bit deeper.
Yeah, and I just want to go back to something that you just said a little bit, and that is that remember the hygienists, I call them periodontal therapists, and the dental assistants, I call a dental assistant a clinical partner because they help us co-diagnose and they help us recognize who needs more attention. So while I'm drilling and filling and doing the stuff that I need to do, I might not have the same kind of face time with the patient that the hygienist has when you go in for your regular cleaning appointment. And so that's the person that I need to make sure understands the process and how to motivate the patient. Now, the interesting thing is the dentist has to validate that that's a worthy agenda, or the hygienist could care less. So in other words, I can't get them to care unless there's some leadership in the office saying and stating that, hey, we're not worried now about just tooth preservation, like preserving your tooth. We need to do that, but we also need to think about all the systemic inflammation and the cumulative inflammatory burden, right? If you have all this inflammation, and where does that start? It usually starts and is generated by the stuff that sits on your teeth. And now you're asking me an interesting question. Is it plaque, or is it tartar, or is it calculus? You might have heard those words. And there was a time when we thought that all plaque was dangerous. And plaque is the furry, fuzzy stuff that you feel on the teeth if you drink a soda pop, like with sugar in it, or you ingest something that is a carbohydrate that can be fermented, or you eat a Snickers bar, and a couple hours later, you take your tongue and you feel the teeth and they feel a little fuzzy or a little furry. That's the plaque building up on your teeth. But we don't call it plaque anymore. We now call it biofilm, because it's not just like plaque. We thought plaque is it's just all healthy. Well, now we know it's called biofilm because it's not just single organisms that are stuck to your teeth. It's like a layer that comes on your teeth, and that layer has a whole it has a whole ecosystem to that layer. And that biofilm can either have a good attitude or a bad attitude. And if it's healthy and happy, it's not going to hurt you. You'll brush it off, it'll feel better, but it's not going to hurt you. But if it's pathogenic, and if it's made up of some of the wrong actors, it can cause a host of issues. And in Ford, we're up to 57 different issues now from some of the bugs that live on and around the teeth. And, I say on and around because we're not talking about just the teeth. We're talking about the lips, the tongue, the cheeks, the tonsillar pillars, the back of the throat, the roof of the mouth, under the tongue. I mean, they live in other places of the mouth. And then if you leave that plaque on there, or that biofilm on there long enough, there's a lot of calcium and there's a lot of calcifying elements in the saliva that comes out of your glands in your mouth. And so what happens over time, it starts to harden. It calcifies a lot like, well, you have soft plaque and you have hard plaque in your arteries. Well, it's the same thing on your teeth. You have soft plaque, and if you get it off in time, it never gets hard. But then if it sits on there long enough, and normally where people get it a lot is in behind the lower front teeth, like they'll go to the dentist and they'll get their teeth cleaned and they'll feel with their tongue and they'll say, oh, I feel some grooves now or some ridges. Well, they used to be there. They were always there, but they were filled in with calculus because that, or tartar, that's an old school word for that. And that was making it feel smooth. And now you feel the anatomy again because the hygienist, the periodontal therapist, scrape that stuff off, those barnacles. And that tartar too is interesting that you would bring it up, but that tartar or that calculus, it's like a microscopic coral reef for bacteria. I mean, it's rough, it's tenacious. It has a surface layer, it has a bottom layer where stuff can hide underneath. And wherever you have that, you're going to have an erythematous band, an inflammatory band of redness. around that, and they scrape it off and it heals, and it's perfect. And that's why we have to have some regularity to how we remove it, and we create the regularity. That's how often you should come to the dentist. We create that based on your own personal ability to remove it. Most
I was
often,
at the I
yeah.
was at the dentist last week, and the hygienist said, "Yep, you've got a lot of this on the inside of your lower teeth, and most people do, but you're special."
Nice. So you must
Yeah, I don't want to be special.
so you must build up a lot of it. And people ask me, what builds that up? Um, I see some people who really build a lot of it. And I'm sure it has to do with the mineral content of your saliva, and the ability for that biofilm to sit on the teeth. So even good brushers, even people who brush and know how to brush and work at it, you're going to typically build up some calculus because it's hard to get in between the teeth.
Mm,
And if you start to age a little bit forward, like you and I have a little bit of gray, if we start to age a little bit, we lose some gum architecture, right? We get a little
yeah,
recession. And when we get a little recession, the teeth are no longer just nice and convex. They have convex. They have concavities and they have little areas, nooks and crannies
true.
that you just can't get it with a brush. So we're
Yeah.
going to talk about some of the ways we can get in there when you don't have a, when you have some of that recession and you don't have ideal anatomy. What can you do?
That sounds exciting. You ready to dive in?
Yeah, let's go.
So, Doug, tell us a little bit about your world.
Yeah, well, this is the inside the Wellness Dentistry Network. This is a slide that we teach our folks about dentistry and our wellness dentistry network folks. They we teach every month. We have a webinar series, and so I wanted to bring a couple pieces of what we talk about to the consumer side. So on the next slide, you're going to see that people often ask me, how do I clean my mouth, and like what's the best way to do it to avoid this plaque buildup and this eventually change of this biofilm to calculus or tartar. And really the first thing you want to do for it is clean in between the teeth. So the step one, the very first thing is you need a methodology for cleaning in between the teeth. Some people do it with dental floss. Some people do it with little brushes that fit in between the cracks of their teeth. Some people do it with oral irrigation. You might know that as a water pick or a hydroflosser, or there's different kinds of things we could do. So that's the first step, is to clean in between the teeth. Then if you're using any kind of mouth rinse for whatever reason, and we have people that we're working with, that part of your audience actually have worked with us, and we often prescribe for them a therapeutic anti-biofilm rinse, because their biofilm has a bad attitude, or they have some bad acting bugs after we do a saliva test. And I think I'm going to show one of those at some point. But the next thing would be use your rinse. And most rinses should be used for about a minute. Swish and spit, pretty easy. And the rinses have different potency based on what the bacteria load looks like. So once I see what the bacteria load looks like in your mouth, then I prescribe the appropriate rinse. And then the third step is actually brushing your teeth. And why do we brush last? We brush last because we want the film of the toothpaste to stay on the teeth, because that's where a lot of the remineralization happens, or the beneficial pieces of the toothpaste are in there. And so this is the order, and this is the steps that you'd want to do it. And you might ask a really reasonable question, is why do we do it wrong? And why we do it wrong is because if you listen to any public service announcement, any commercial for any dental products, what do they say? Brush and floss, brush and floss, brush and floss. So subliminally, they're telling us brush first, floss second. I don't want
Hmm.
to do that. I want to clean in between the teeth first, so the rinses and the beneficial pieces of the paste get in between the teeth. And the only way you can do that is get the chicken out first, if you know what I mean.
Absolutely. And I love chicken, so
You know what I mean?
so a couple of quick questions. You know, I've often heard, we had Lou Ignaro. You may not know him. He's a Dr. No, nitric oxide,
Yeah,
the
right.
fellow that won the Nobel Prize for that, and he was talking about how be careful with mouth rinses and their impact on nitric oxide. The other thing, I remember you and I talked a little bit about toothpaste last year and whether, you know, whether and when you should use toothpaste and when you should maybe dry brush. So if you could make sure and cover both of those when you get into
I
these.
can, and I can, and I'll make the case for nitric oxide simple. If you have a normal biofilm that's healthy, there's no reason for you to use any kind of mouth rinse. If you
Mm,
want fresh breath, use a mint, use some gum, do something, for fresh breath. But you don't need to attack the microbes in your mouth if it's healthy. If it's not healthy, however, that's when you need a rinse. And while you're on that rinse, if you want to supplement to nitric oxide, Ford, you tell me what's the best supplement today for nitric oxide if you want to supplement to it.
well, I would say breathing through your nose. And you're saying, wait a minute. No, if you want to
I know
supplement.
I love that because we encourage lip sealing. By the
Yeah.
way, if anybody emails me, I have found a beautiful company with some very nice lip tape. It actually has collagen building products in the adhesive on the tape.
Oh, that's
And
interesting.
vitamins on the tape. That's how sophisticated it's getting. It's not just promoting mouth taping. It's saying, why don't you let me rebuild your lips and rebuild your skin quality while you're taping? I mean, I don't know what the science shows there, but how cool is that, right? The companies are
It
getting
is.
pretty sophisticated. I think that this will tell us a little bit about the water flosser, and this is the step one. So this is an interesting one because the water flossers are very beneficial, and why we use them is because your toothbrush bristles can't get all the places water can get, and these water picks create quite a bit of shear force, meaning they
Mm.
mechanically disrupt the biofilm as well. So they work really, really well. And if you notice in the upper right hand on the slide, there's all kinds of other little tools that you can use. But the idea is we have to clean in between the teeth. And if we're going to use paste, which we're going to get to, if you're going to use toothpaste, we have to decide. We need to make sure that the stuff's out from in between the teeth. So this is just another little enhancer about step one, and we can look at the next slide. And then if you have more questions about water picking or water flossing, but again, these people with braces and uh, complex restorations like implants, sometimes it's not so easy to get into these nooks and crannies. And you can do it really, really good with this. And this will really cut down on the gum inflammation. If you just use an oral irrigator or a water pick, it works amazing. So I
So,
ask all my
Doug,
questions.
I use floss, string floss, because I think that sort of disrupts things. And then I use the water flosser, and then I brush. And since talking last year, I dry brush about 3/4 of the time. But I have, as you mentioned, I'm an old guy. I'm 68, so I have some issues with sensitivity, and so I'll use one of those Sensodyne kind of
Sure,
toothpaste.
perfectly.
So that's okay.
Yeah, those are the Sensodyne products have really done a nice job with adding some components to the paste, potassium nitrate, different components to the paste to help with sensitivity. They have both fluoridated versions and unfluoridated versions, and most pastes do now. By the way, there's quite a few other options other than just fluoride in the paste. And the buzzword of today is nanohydroxyapatite as a
Mm,
paste additives. So
hmm.
dry brushing is fine, Ford, but as long as we're using a paste that's not super abrasive, that's a good thing. And all dental pastes have a number. It's called relative dentin abrasivity. They have an RDA value. and that RDA value should be below 70. These are creamy, soft paste. Some are even marketed now as gels because they've taken a lot of the silica and a lot of the abrasives out of the paste. And so it's a little catch-22, you know, how abrasive do you want the paste to clean the stain off the teeth versus the therapeutic elements that are in the paste that makes the teeth harder or for less sensitive. The sensitivity can be controlled with some of those pastes as well. So for dry brushing, if you wanted to dry brush a little bit less, if you're using a paste that's non-abrasive, that's pH balanced, it wouldn't matter to me. You could use paste 4 times a day if you wanted to. You know?
Well, that's good to know. How about the flossing? Am I overdoing it?
No, the only thing with flossing is, here's what I have seen. I've seen some people who put the floss through and then they just go back and forth a bunch of times. And if you think about the friction of the fibers, you can actually cut a notch in your tooth.
Yeah.
So flossing should be wrapped and then it should go up and down, not like seesawing back and forth. And that's what a lot of people do. So let's just say flossing won't hurt the teeth if it's done properly. So proper flossing is important. And, you know, even these little wishbone flossers right now, if you put the wishbone flosser in, what you do is hug one side of the tooth and then pull up and down, hug the other side of the tooth, pull up and down. There's no room to go back and forth because they're so short, you know?
Yeah, I've been seesawing. Not hard, not much, but I'll remember that.
Well, on your x-rays, you'd be able to tell if there's any notching. I've seen people cut the teeth almost in half.
Oh my gosh. I haven't done that.
Yeah, because the floss will sit in that groove, right? It'll find that groove, and then it just keeps wearing down.
Keeps going back and forth.
Yeah.
Wow.
This is the step 2 is the rinse. And so remember this, we're going to rinse, and this is where you have to decide what kind of rinse am I going to use. And remember, Ford, the big thing is you don't need a rinse if your mouth is super healthy. You just don't need a rinse. So why and on the slide for your audience to either take a picture of it or look at it, because I know there's quite a few words on the slide. It's why do we do the rinse? We rinse because we rinse now because you've cleaned the stuff out from in between the teeth, and I don't want to wash off the ingredients from the paste. So if I need a rinse, now's the time to use it. That's why we call it step 2. And
now, and you're saying you only rinse if you've got bad bugs, right?
Correct.
So how do you know?
Well, that's how we do a bacteria test, and we're going to see that in a minute. But before I do that, see the big red circle with the line?
Oh yeah.
Be careful.
Looks like it's. I'm sure we'll get demonetized for saying it, but it looks like Listerine.
No, I'm not picking on any products. I'm just talking about products that have, because all these products have acid. They either have alcohol as a preservative or they have acidic components because it's a great preservative. But we want to be careful only because if the biofilm is bad and it's cavity causing, they love acid. So they love an acid environment. So you surely don't want to make the environment more favorable. Even though there's some antimicrobial activity in many of these rinses, they're not powerful enough to kill all the bad bugs. So some of the bad bugs linger behind, and now you create an acid environment. It takes the body some time to come out of that acid state, if you will. Your saliva is trying to constantly buffer the mouth to make it more neutral. And if you attack it with acid a couple times a day, it's just not healthy. You don't need to do that.
So it's clear if it's got alcohol, it says it in there. But what does it say if it's got acid in it?
It doesn't say. The companies that have low pH will never, they're not proud of that.
So how do you know?
Yeah, you can email the company. We have a sheet. I'm happy to provide you a sheet of acidity of a lot of the common rinses. And you'll see today that even from our sheet, there's rinses coming out all the time. So it's impossible to totally stay current. But I can tell you there's good products in your drugstore over the counter right now. And even on the top of the screen right now, you see a few products that have very good pH. They're pH favorable, but there's many of them. There's quite a few now. And then there's
And
There's the company that makes the box of products on the left-hand side on the top row. That company called, and I'll just name the company because it's a great company for anybody who's struggling with cavities, or if you want a high quality non-fluoridated paste or gel, or you want a high quality fluoridated paste or gel, you could get it from that company, and that's the Carry Free company. So it's a dental, we use it in the dental industry. You're not going to see it on the drugstore shelf, but you can order online from them.
so back to the question about brands, it looks like all the major brands are the ones where you're more likely to get acid.
Yeah, they are. There a lot of them are, and a lot of them are, and so it's the world of formulating products in dentistry. I mean, just go to your drugstore and look at those aisles; they're filled with stuff, and it's a lot of marketing. And for it, there's a dental formulators podcast. If you really want to get into the weeds about the products that are into pastes and rinses, there's a dental formulator podcast. And when you listen to that, I've spent an hour listening to a dental formulator talk about the science of what they put into a rinse or a paste. It's unbelievable, the marketing hype and the things that are out there. So you really, two key components that I want to key on: find out from the company what the pH is of your rinse and your paste, and find out how abrasive it is. So if you can manage those two things, it's going to be really helpful. And the Sensodyne products that you mentioned are great. Most of the major brands have a paste that's not highly abrasive, and then you just have to decide, do you want fluoride in it or not?
Very helpful. I think we may want to get a list from you rather than trying to trust
Yeah,
the
we can
companies.
do that. I can provide a few. Yeah. And then step 3 is going to be your brush. And the one thing that I want to remind people of is whatever toothbrush you like to use and that you find is joyful or that you enjoy using, that's good enough. We just have to learn to use it properly. And Ford, what a lot of people do is they buy an electric toothbrush. I got a couple pictured on the upper left. They'll buy an electric toothbrush and then they use manual motion with the electric toothbrush. And that's not what we need to do. Electric toothbrushes are supposed to just be held in place, let them do their work, and then move them on. You don't need to really scrub with them. And that's what a lot of people do. And it decreases the effectiveness of the toothbrush. So
But Doug, it's really hard not to move it.
I know it is. I moved my own a little bit. We just got to try to stop that. That's what I tell myself when I'm doing that. I said, why are you moving that around? It moves for you.
Keep doing that.
It moves for you. But it's just hard. It's a hard habit to break. But the average person brushes for about 30 seconds. So when you put that in there, and they all have 2-minute timers on them now. So you really want to try to slow down and let the brush do the work, and move it around. But we're all in a hurry. We're all in a hurry to get to work and complain about work all day. So yeah, you have to slow down. So these powered brushes now have timers. They have pressure sensors. Getting pretty sophisticated. You can spend $450 on an electric toothbrush. Comes with a phone app, tells you when you didn't brush. You don't need that. Wow. You can buy a $3 toothbrush and be just as effective as long as you use it properly. So that's the big deal. And I put the word on the screen on the bottom right in the one box. That's nanohydroxyapatite. That's the new buzzword. And I put down a couple brands, and these are brands we trust. These are brands that you can get over the counter. One of them you can get online. But for your listening audience, I need you to have at least one name of a product that you can use that's going to be safe. It's going to have the right kind of nanohydroxyapatite. That world is all over the place. And
so maybe Jesus can make it in really big letters and put it across the screen. And that's basically for folks that are hesitant about using fluorides.
Yeah, we need the right kind of nanohydroxyapatite to really work. And there's a lot of knockoff brands of that. And as a matter of fact, in Europe, some of it's been banned because it's not healthy. So just do not pick up any tube or of something, and if it says nanohydroxyapatite, just use it. So I put the name of 3 companies on the bottom that I think are very reliable. Some are fluoride free, some are not. And you can just just ask us if you have any questions. We're happy to answer that. And I put a couple products on the screen that you can count on.
So nanohydroxyapatite sounds like a chemical name. How can it be? How can there be bad versions?
Well, it's basically a lattice for the mineralization process to happen in your teeth. Are made out of fluorohydroxyapatite, and so they manufacture this to get into the tooth. And nano, that's a small particle size, and so they get into the tooth, and it's just basically a lattice. So without calcium, without phosphate, without fluoride, nothing's going to happen with the nanohydroxyapatite, but it becomes a lattice for the other molecules to bind to it and build and actually harden the tooth surface. So that's
so the differences between them might be whether you have the other stuff like the phosphorus and things like that.
Yeah, correct. And that's why, and you get that from the food you eat, right? You get it from food you eat. That's why we need some green leafy vegetables and some of the things you talk about in dietary management, right? We need that. And I think you asked me earlier, how do I tell if your bacteria is good or bad? I think we might have a picture. There could be a picture of a saliva test, but this is what we did. By the way, go back to that. If we can just go back forward to this one test. This is the way, and some of your folks have worked with us through home dental exam, but we have people with different risk factors. I mean, this from your cardiovascular management. Your medications, your genetics, your lifestyle habits, all those things come into play. But ultimately they affect your oral microbiome. We call that the oral biofilm. And how do you know? How do you know what you have? And how do you know what to do? And that's what we've tried to create with home dental exam. So home dental exam, you've talked about this before. You can go online, homedentalexam.com. And our idea was to provide people that might not have access, just to provide them a source of being able to measure the microbiome and determining, is the attitude good or is the attitude bad of the microbiome? And I think on the next slide, we show a test. And I don't want you to become too overwhelmed about the test, but if you look at simply the green boxes, the yellow boxes, and the red boxes. If the red boxes are highlighted, we have too much of that. If the yellow boxes are highlighted, it's kind of like, whoa, maybe we should be thinking about modifying that a little bit. And if it's green, then that's a pretty good thing. And so this was actually a patient from your group that went to home dental exam and ordered a test. And now my issue is I never meet them. I don't know who they are. I don't know all the risk factors. I don't know their medical history. I only know about their attitude of their microbiome. And so what we recommend, we make a series of recommendations, and then we ask for a retest. And usually 6 months or sometime in the future, we say, do these things and retest. And what I want you to do is take into account there's 4 red boxes, there's 4 yellow boxes, and there's 5 green boxes. And then I think if we go to the next slide, and now we look at the number of green boxes versus the number of red and yellow boxes, look at the difference. Just from us recommending some products and the person doing something different at home through the internet, never met. This is the idea. And this is what we want to be able to do for people, is we want to change the attitude of the microbiome. Now, what I would love to do is I would love to know more about his dentist and, how they maybe contributed to, maybe what kind of medical things were going on at the same time. but we don't get a chance over the internet to take that deep of a dive.
So for the viewer, there's a lot of stuff here. It's maybe a little bit of a challenge, but you're talking about if you look at 2 pages with that green arrow in between, you're
Yeah,
talking about the last column on each of those 2
correct.
pages where you
Very
go
last
from
column. Yep.
what, 5 greens,
Yep.
4 yellows, and 4 reds
On the
to
left. Yep.
everything green on the right except that one red.
Yep. That one red, and that one
Major
red.
difference.
And that one red is actually a pretty low risk pathogen. So I'm not jumping up and down about it, but that's not a reason to, I mean, this person's in a much better spot
Yeah.
than they were before. That's the idea. Now, I don't want to belabor the point, but in all fairness, Ford, if we could just go to the next slide. And this is another patient. And yeah, there you go. That's good. Go to one more slide that one. What about the patient who has some reds and after they thought they did what we said, they gets worse? What if that
Well,
happened?
it's one of the things that we're looking at more and more and more because we provide so much individual education. And because basically what we're saying to folks is be careful what your doctor just tells you to do, especially if he or she's just giving you a statin and walking out the door. You need to know a lot more.
Yeah.
On the other hand, that sort of sets us up to be a do-it-yourselfer kind of resource. And we've got mixed emotions about this because this is your health. It's not, and it's very science. It's very intricate. In other words, we're making ourselves a resource for do-it-yourself, but we feel very strongly that this is not a DIY thing.
Yeah,
Now,
but I can also tell you this is not normal. So this is
is that
not
right?
normal. So if this happens, you're getting a phone call from me. You're getting
Good.
it. This is not normal.
In other words, this person needs help. This is
Yeah,
no longer DIY.
no, there's something else happening here. We got to find out what it is. And this
Yeah.
person, so it's beneficial to go, and this is not how it usually works. So I showed it in fairness and balance. And this person is been very nice to work with, and we're continuing to help on the phone. And this process, this home dental exam process, is new. No, I mean, no one's really doing this like this. So we got some bugs to work out too on our side. Getting test results back on time, helping people clarify, trying to learn when they fall off. I mean, how do you know, Ford, if people follow all your recommendations the way you recommend them? And how often do you check in? And it's all getting better. But the idea is, and I think if you go to the next slide, I think these are some of the questions. I think right, results like this deserve further investigation, and we want to figure out what's going on. I want to talk to your dentist. I want to review what you've been doing. I want to review, are there other kinds of issues? Are you getting infected by somebody else? I mean, what's going on? Because it's not normal. And for people to even take the effort to order the test and then do some of the things, man, we want them to get results, right? We want them to have good results. So that's the idea. And I'm sure you do too.
So, Doug, I've been to a lot of dentists outside of my professional career and my exposure to you. Never, ever, ever, ever had one talk about this and about 2/3 of the stuff that you talk about. And I know from working with you at the Wellness Dentistry Network, it's not just you. There's dentists out there that understand this is not just drill and fill.
Yeah, and one of the things that we're getting to, Ford, and I know you mentioned in the beginning, tell me about the network. Just because people come to a course, just because they pay the fee to belong to the network, that doesn't necessarily mean that they're doing everything like we're doing. So this year, we're actually developing a certification program, and you need to earn the right to be on that website. I need to see some successful cases. I need to know that you know how to read salivary diagnostics, or you need to know how to read these tests. And so we're creating a certification process because I want to people when they go somewhere. And one of the issues with one of our clients, one of your clients, is I recommended a dentist. That dentist, who was a graduate of a program that I have a lot of respect in, hired an associate dentist. The associate dentist never been to the program.
Didn't do it.
Right. And so now it's my reputation, because I said this is an office where, this should be understood. But I mean, let's face it, this is reality, right? So that's where I got to get involved, and I got to help, work those bugs out. But the idea is, I want when we refer you a patient, and I refer you somewhere, because I can't take care of everybody. I want to make sure that the person who's taking care of you understands the language, knows what to do, and knows where to reach out to get help. We have a very clean process on how to help offices around the world with some of these difficult cases and what to do. And it's an exciting time for it. I'll never exhaust the amount of work that there is to do. It's unbelievable how many people need help out there.
I tell you what, Doug, thanks again. As we talked before we started, we've got several hours worth of catching up to do. And we don't have that kind of time. But it's been a very exciting, rapid trip through your world again. We'll have to have you back quicker this time.
Yeah, you let me know when you have, you know how it goes. You have your people reach out to my people, and we'll do it.
Well, tell your people I said hello.
Yours too. And I really appreciate it. And I appreciate you for it. Thank you.
Thank you.